Did you know that not all the drugs reach every part of your body? Even if you swallow a powerful medicine, it might never reach your brain or your baby in the womb. Why? Because your body has physiological barriers, natural protectors that control where a drug can go. So in this video, we are going to discuss these physiological barriers. So first of all, what are they? These barriers act like bodyguards, restricting the movement of drug molecules from the bloodstream to different organs or tissues. They are mainly divided into simple barriers and specialized barriers. Simple barriers like cell membranes and capillaries. Specialized barriers like the brain, placenta, and testis barriers. Okay. Cell membrane barrier. Every cell in your body is wrapped in a protective membrane. For a drug to enter the cell, it has to cross this membrane. This depends on the molecular size, lipid solubility, and degree of ionization. Small water-soluble drugs under 50 daltons can pass through these pores. Larger than that needs special help like active transport system. Okay. Then we have the capillary endothelial barrier. Capillaries are the smallest blood vessels. Okay. Most drugs with a molecular weight 500 to 600 daltons can diffuse through this into the extracellular fluid easily, whether they are ionized or not ionized. However, these drugs that are bound to plasma proteins cannot pass through because the complex is too large. Okay, penetration will be not there. Then we have the BBB. It comes under the specialized barrier. The blood-brain barrier is extremely selective. Okay, this the endothelial cells in the brain are tightly joined with no gaps. So only lipid soluble and non-ionized drugs can pass into the brain. This is why the only lipid soluble unionized form of drugs can pass through. Okay, this is the reason uh, drugs used for infection or inflammation fail to act on the brain. They simply can't enter into the brain. Then we have the blood CSF barrier, cerebrospinal fluid. CSF here stands for cerebrospinal fluid. This barrier works just like BBB, blood-brain barrier. Only non-polar and highly lipid-soluble drugs can cross easily. Even if a drug is slightly polar, it will pass very slowly. Polar or ionized drugs are completely blocked here. Okay, polar and ionized drugs are completely blocked. Then we have the blood placenta barrier. This barrier separates the mother's blood from the fetus. But unlike the brain, this one is not very strict. It allows many drugs to pass through, especially non-polar and lipid-soluble drugs with a molecular weight of less than 100 daltons. This is why pregnant women need to be very careful with medications. Then lastly we have the blood testis barrier. This barrier protects the developing sperm, okay, in the testis. It forms a tight junction between Sertoli cells. It prevents harmful substance in the blood from reaching the sperm, ensuring proper fertility and function of the reproductive system. So, our body is full of smart security checks. Some allow drugs to pass freely, others completely block them. That's why a medicine that works on the skin might not work in the brain or fetus. It's all about how well the drug crosses these barriers. If you found this explanation simple and helpful, hit the like button and share this video with your class friend. And don't forget to subscribe, and we'll meet in the next video. Thank you.